storm vulnerable, as though something bad is about to happen. What we saw with Katrina was that all of these bad things had happened long before the storm hit, and the storm just made it so much more visible to all of us.
Typically, there are not deaths in disasters. Going up and down the streets and knowing there was a body found in a particular house, it was like a war zone.
A major disaster, 1 million people displaced, those who are least able to recover in this sort of disaster. And it brought together what we try to do as a foundation. Our mission is to improve the health and healthcare for all Americans by affecting the systems in which health and healthcare are delivered.
Within days, Dr. Lumpkin started pulling together staff.
The people on the Katrina team here at the foundation came with such extraordinary expertise and passion.
Our very first grant went to the American Red Cross, and this grant was for $1 million. It usually takes us months to get out a grant for $1 million. We did it within 5 days. We provided grants to the Salvation Army, the CDC Foundation, our grantees to New Orleans and the Gulf Coast, to community health centers to help them get back up and operating.
What we realized pretty quickly is that we couldn't do it on our own, that we had to go through intermediaries who really understood the local culture and the local dynamics.
It was the Louisiana Public Health Institute that could play that role. We began to look at them as a go-to organization to be able to fund our grants, to identify people in need, and also to help make sure that where our grants were going were where the need was most important.
We had huge disparities in access to health care, not only for years prior to the storm, but for generations. When the storm hit, the same wind hit everybody. The same flood hit 80% of all residents of the city, including some of the wealthier neighborhoods. But the difference was the situation of the people who were impacted by the same weather. And so many of those people were carrying chronic diseases that were not well managed and did not have insurance to give them options for how they could reconnect to the care they needed.
I think it's really easy to look at the news and to say, you know what, I think I can make a difference there, and I'm going to go down and I'm going to change the world and everything's going to be okay. And then when you put yourself in that situation, it really sort of forces you to think about what you have inside of you that could actually make a difference, both in the immediate term and over the course of an entire career.
I considered not reopening the clinic because everything was gone. Robert Wood Johnson helped to get supplies to refurbish and rebuild our clinic. With our new building, I didn't want it to be a place where people came to be sick. I wanted a place where they came to be well and stay well. Teach people to take care of themselves and to live healthy and be healthy and have a healthy community.
So much was committed to our immediate needs and our longer-term recovery. Going forward, we want to be sure to close the disparity gaps. One of the grants we're administering is the expansion of neighborhood primary and preventive care. And we actually have about 15% more people using community clinics than when we started a year and a half ago.
There needed to be a new way to try to deliver care. The Reach NOLA partnership really emerged out of my participation in the Robert Wood Johnson Clinical Scholars Program and their support of me working in New Orleans. We bring care to people who maybe haven't been able to get the health care that they need.
There's many days I don't feel 100%.
Those mental health problems as a result of the hurricane are still the #1 health problem that we're facing. Anywhere we go in this city, 1, 2, 3, okay, we hit the third person, that person has had depression or PTSD. It's a public health crisis.
Mental health was a huge issue. Everybody has mental health needs, not only the people that we would normally think as victims, but the people who were helping the victims.
We worked with the first responders, the firefighters were there and the police were there. People who otherwise would not access mental health services. We said this is going to be an important part of helping people be able to do their work and also build resilience and feel better. We do a lot of outreach in schools. That was one of the things that we did with the Robert Wood Johnson grant. The leadership program was designed to build resilience, the idea that one gains strength from helping other people.
Going through this program and doing the things that we do, we're slowly changing the attitude of the entire parish to not just I don't care, but I want to help others.
Whenever there's a disaster, people want to help. That's who we are. We're Americans.
Katrina brought all the foundation together. Staff, no matter what program they were working on, they thought of ways that they could have some impact. Some of our staff went to help out personally, to volunteer their time.
When the hurricane struck, we had a 7-month-old baby at the time, and I said to my husband, I need to go. And he said, so go.
Hey, Miss Tyra.
Happy Mother's Day.
If it weren't for the volunteers and the efforts that they're doing, we wouldn't even be able to think about rebuilding. And now we can even think about our community.
Philanthropy is about not only giving our resources, but giving of ourselves. Our foundation is about caring. And I think Katrina was one of our finest hours.